That's wonderful. I'll just wait a bit. I'll keep it back.
Sir, one more. She's a from Bangalore Medical College.
Okay.
One more big medical college.
Nice to meet you.
Just my good friends and supporters. Yeah. Very warm good morning to all of you who have assembled here, and sincere thanks to, all of you, you have taken time off your busy schedules and to attend this inaugural function of the Pediatric Pain and Palliative Care Program at IGICH. I thank our dear Director, Dr. Sanjay K.S., our Medical Superintendent, Dr. Prahalad Sir, and the RMO Sir, Dr. Mahatesh, for their unwavering support with this initiative. To kickstart this event, I wanted to ask Dr. Pradeep Sir to do the honors of launching the event live. Pradeep Sir is probably busy. Madhvi ma'am, will you please press the event live? Which one? Yeah. Okay, ma'am. Thank you, Dr. Madhvi ma'am. A big warm welcome to the virtual attendees as well. So before we proceed further, let's just take a quick minute to connect ourselves with the higher power to ensure that this momentous occasion is blessed with positive energy and also blesses with wisdom, courage, and strength in our daily endeavors. I kindly request our beloved medical superintendent, Dr. Prahalad Sir, to lead the invocation.
Good morning. It's my pleasure to thank the organizers, including our Bureau Director and Dr. Chandrika Madhvi and Nurada and her team for starting the important the pain palliative care. Today is an inauguration. We have the guests from outside India. So for this, fortunately today is our director birthday also. So wish him a happy birthday, and the song, the invocation song for the palliative care of Indira Gandhi Institute of Childhood, as well as for the director I am dedicating. So, Gachamukani Siddhidayakani Vandipe Sharanu Sharanu Gachamukani Siddhidayakani Vandipe Sharanu Sharanu Trijagavanditanada Devadevane Sharanu Trijagavanditanada Devadevane Sharanu Sujanarige Vidamanu Pariharike Sharanu Gachamukani Siddhidayakani Vandipe Sharanu Sharanu Mandamatiyanu bidisi Chandajnanavani ಇಂದಿರೇಶನ ಪಾದ ಪತೆ ಮಂದಮತಿಯನು ಬಿಡಿಸಿ ಚಂದಗಾನವರಿತು ಇಂದಿರೇಶನ ಪಾದ ಪತೆ ಸುಂದರಾಂಗನೆ ಪದದುಂಬ ಕೆರಳುವೆನು ಸುಂದರಾಂಗನೆ ಪದದುಂಬ ಕೆರಳುವೆನು ಸಂದೇಹ ಮಾಡದೆ ಇಂದು ಕರುಣಿಪುದೋ ದಶಮುಖನೇ ಸಿದ್ಧಿದಾಯಕನೇ ವಂದಿತೆ ಶರಣು ಶರಣು ಸಿದ್ಧಿದಾಯಕ ನಿನ್ನ ಭಕ್ತಿ ಮೆರವೆನು ನಾನು ಅತಿಶಯ ಮಹಿಮೆ ಬದ್ಧದಲ್ಲಿ ಸಿದ್ಧಿದಾಯಕ ನಿನ್ನ ಬುದ್ಧಿ ಮೆರವೆನು ನಾನು ಅತಿಶಯನ ಮಹಿಮೆ ಬದ್ಧದಲ್ಲಿ ಶುದ್ಧ ಮತಿಯನ್ನು ಕೊಟ್ಟು ಉದ್ಧರಿಸಬೇಕೆನ್ನ ಶುದ್ಧ ಮತಿಯನ್ನು ಕೊಟ್ಟು ಉದ್ಧರಿಸಬೇಕೆನ್ನ ಮರ್ಬವಲ್ಲಭವೇಣೋ ಕೃಷ್ಣಗತಿ ಪ್ರಿಯರೇ ದಶಮೋಕರೇ ಸಿದ್ಧಿದಾಯಕನೇ ವಂದಿತೆ ಶರಣು 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 ಶರಣು. Thank you. Once again, I wish you all the best.
Thank you for that melodious rendition, sir. I would now like to call Dr. Priya. She is Assistant Professor of Pediatric Surgery Department. Good morning, everyone. I am Dr. Priya. I am really privileged today to introduce Dr. Madhvi Ravindra ma'am today. She is a professor and head Department of Anesthesiology in Indira Gandhi Institute of Childhood. Ma'am is associated with Indira Gandhi since 2007. She is a program director of Pediatric Anesthesiology Fellowship Program. She is also a founder director of Indian Association of Pediatric Anesthesiology, Karnataka branch India. Welcome you to the welcome address now.
Thank you, Vinu. I extend a very warm welcome to all of you, and especially to Dr. Stuart Brown and Dr. Gayatri Palliative, who is with us online. We are here to renew our commitment to take care of pediatric chronic pain as well as the palliative care in pediatrics. This is a very neglected field so far. This has been maybe because of lack of commitment or lack of awareness, mostly lack of resources, and also lack of training. And thankfully, our department has started some baby steps from last year, and we have already treated around 50 children with either chronic pain or those who require palliative care in the past 1 year. And we hope to do much better with the cooperation of all of you. So without taking much more time, I call Anu to start the event. Thank you.
Chief guest, Dr. Stuart Brown. Please hand. Welcome, sir. Dr. Dhaval Shukla, sir, and the defense team. Dr. Sandhya and Dr. ma'am. Thank you so much for all the time and coming. I now request Dr. Manasa to come over and
Yes,
Good morning, one and all.
Dr. Chandrika.
Yes.
Come, Dr. Chandrika.
Dr. Chandrika as well. Okay.
You are there. Come.
Please accept. Yeah, please accept.
Yes, please. You are invited.
No.
Please accept.
Yes. All the best. Come.
Good morning, one and all. I am very honored to call upon our esteemed dignitaries on the stage. Our beloved director, Dr. Sanjay K.S., who could not be here with us now. Dr. Stuart Brown, Dr. Prahalad sir,
Just lighting the lamp.
Dr. Ramesh sir, Dhaval Shukla sir, Gauri sir, Shri Ganesh sir, I welcome Dr. Sanjay K.S. to the program today. A very happy birthday, sir.
Thank you.
I call upon our esteemed dignitaries on the stage, our beloved director, Dr. Sanjay K.S.
Sir is the Director and Professor, Department of Pediatrics, Inauguration Institute of Childhood. Sir is the Fellowship Program Coordinator.
Dr. Stuart Brown, sir. Prahalad, sir. Dhaval Shukla, sir. Gauri, sir. And Shri Ganesh, sir. Asitoma Sadgamaya, Tamasoma Jyotirgamaya, Mrityoma Amritangamaya. Light leads knowledge from ignorance, towards brightness from darkness, and immortality towards immortality.
Grounds. ಎಲ್ಲರೂ ಒಂದ್ಸಲ ಸರ್ ಪ್ಲೀಸ್
I'd like to use this opportunity to wish our director, Dr. Sanjay, a very, very happy birthday. I request Sheetal to give him a small token of our appreciation from the Department of
Thank you, sir, for formally inaugurating our function. The reason why we have gathered today is to formally inaugurate the Pediatric Pain and Palliative Care Program at Indira Gandhi Institute of Childhood. I would like to give you a quick introduction to palliative care before we dive into the rest of the program. All of us have heard about the 4 cardinal principles of medical ethics: the autonomy, non-maleficence, beneficence, and justice. I firmly believe that the most important tenet that is binding the 4 ethics is the concept of non-abandonment. Non-abandonment can be viewed as the essence or one of the core values of a physician's central ethical obligations. It reflects a longitudinal commitment, both to care about the patients and to jointly seek solutions to problems with patients throughout their illnesses. Non-abandonment reflects a continuous caring partnership between physician and patient. The relationship may begin in health or in sickness, last through potential recovery or adjustment to chronic illness, or often continue to the patient's death. It acknowledges and reinforces the ongoing personal commitment to caring and problem solving between physician and patient. There is a world of difference for patients and their families between facing an uncertain future alone and facing it with a committed, caring, knowledgeable partner who will not shy away from the difficult decisions when path is unclear. Truly, the secret of the care of the patient is caring for the patient, as told by Francis P. Ward. So welcome again to Punaschetana, which means revival or rejuvenation. I would like to welcome Dr. Anu ma'am to introduce Dr. Gayatri Pallat. Dr. Gayatri Pallat ma'am will be joining us online from Hyderabad. We are truly honored to have Dr. Pallat with us here today. She's been an amazing source of inspiration to me. Thank you, madam. If you're, I don't know if you're already online on Zoom. Yeah, ma'am is there. I can see her. Okay, ma'am, thank you so much for taking your time out of your busy schedule to be with us today. I'm just going to spend a couple of minutes introducing Dr. Pallat because she's done amazing work. So she's the professor, Department of Pain, Palliative Medicine at MNJ Institute of Oncology and Regional Cancer Center at Hyderabad, Telangana. She's a member board of trustee of International Children's Palliative Care Network. She's also consultant palliative medicine specialist working with 2 World Cancer Collaborations in Canada from Canada. She's a founder member, Pain Relief and Palliative Care Society. She's a course director, national faculty member, editorial board member of Journal of Palliative Medicine. And this slide, just her key accomplishments are she's played a key role in establishing the Department of Palliative Medicine in MNJ, which was probably started as a 2-bedded institute. And she's set up at each district of Telangana as a palliative care program, which is taken care by Dr. Gayatri Pallat. She's been one of the founder members to establish a non-governmental organization called Pain Relief and Palliative Care Society. This is one of the largest NGO in the Telangana region in South India to be providing palliative care in the community through home-based care called Life at Your Doorstep Hospice program. They also run a rural outreach program, and they have a very unique pediatric home-based and hospice program for children with life-limiting conditions in that region. Madam is also a member of Guideline Development Committee for Pediatric Pain, World Health Organization. She works as director of PAX Asia, 2 World Cancer Collaboration, and Dondrit. She's the first professor of palliative medicine. She's actively involved with foundations in capacity building of palliative care in the countries like India, Nepal, Philippines, and Bangladesh. Ma'am, can you hear us?
Yes, I can hear you. Thank you.
Ma'am, we try to get your picture up there.
Can you hear me?
We can hear you, ma'am.
Can you hear me, Anuradha?
Ma'am, we can hear you. I'm just trying to get your picture up. Yeah, we can see you now. Yeah. Yeah, this is good, ma'am. Ma'am, you can start. We're just still trying to figure out to get you on the bigger. That's all. Yeah, just give us 1 minute, 1 more minute, ma'am. Yeah. Ma'am, just give us 1 more minute. If not, we'll just go ahead and start. Yeah. Yes, ma'am. We have got you on the big screen now. Thank you so much for joining us.
So, very good morning to all of you. Honorable Director, Indira Gandhi Institute of Child Health, Medical Superintendent, Dr. Stuart Brown from People's Cancer Collaboration, faculty from various departments, especially Department of Anesthesia. It's a real honor and privilege that today I'm joining you for this such a important milestone in the field of pediatric palliative care for India. I think one of the first government children's hospital where we are going to start pediatric palliative care. And I think one of the few in the country. I think this is a counter figure, like how many places they have like this. So really congratulations to all of you. So with that note, and thank you very much for the introduction. It was like many things which you mentioned. But yeah, so I'll just try to give a short overview about what it means when we say pediatric palliative care and what is the role we can play to help our children with chronic life-limiting conditions. So if you don't mind, I'll just try to share the screen. I would like to share the screen from my end if possible. You can enable me.
Yeah.
You can share. Ma'am, you can share now.
Perfect. Yeah, thank you. Another, can you see me? My screen?
Yes, ma'am, the slide is seen.
So I just want to start with this one simple statement, but it means so much to whatever we plan for our whenever we plan our hospital. Patients are the center of all care, and care should be tailored to meet the individual needs of the patient, not patients meeting the need of the health system. So with that note, I'd like to just let's think about our patients. Here we are talking about children who are with chronic, serious life-limiting conditions. So how many of them are there in our hospital that we need to think about their need in our hospital? So look at this worldwide profile of children who require pediatric palliative care. This is the Atlas, which came very recently, 2017 was the latest one. If you look at it in developing country, they say the biggest need, I think, is reflecting from mostly from Africa, HIV, but otherwise it's mostly congenital malformation, premature birth, and birth trauma. That they become the biggest chunk. Not so much cancer actually. It's mostly premature birth, birth trauma, congenital malformation, and HIV. They become the biggest chunk, and CNS degenerative conditions. I have a program in a tertiary children's hospital in Hyderabad, Nilofer Children's Hospital. We have a pediatric palliative care program. We just looked at 690 children who are referred to pediatric palliative care from the period June to October. And what we found, 64% of children were from neurological condition. They don't see children with cancer. So children's cancer hospital is different. 64% were with neurological condition, of which majority of them were hypoxic ischemic encephalopathy with global development delay. So it's very similar to the international profile, what they projected. So they become the big chunk. If you look at childhood cancers in India again, in the West, where Dr. Stuart Brown comes from, they say children don't die of cancer, but that's not so true in our country. Unfortunately, for various reasons, we still have very poor survival, and the children are dying, and they need palliative care. Again, I am just giving an example of MND Institute of Oncology. Into 2023, we had 695 new pediatric oncology reference registration, of which 394 were referred for pediatric palliative care as a new registration. Almost round figure, if you look at it, it's 60% of children, they require pediatric palliative care at some point of time during their oncology journey. And there are various resources, and they very clearly state that children treated for cancer undergo repeated painful procedures, high symptom burden, and tend to receive high intensity end of life care, which negatively impacts their quality of life and quality of death. That is the truth in India. And when you talk about children, we saw the numbers. So what are the special needs of the children when you talk about children with life-limiting conditions? Their needs are very dynamic and complex at different stages of their illness. And when you're planning for any pediatric palliative care program, we must remember that they need continuity of care over time and different settings. The child moves from home, primary health center, to maybe a nursing home, to a tertiary hospital, and back to home. So they move between different settings because they have some chronic conditions. So they need care, this continuity of care at different settings and a preferred place of care. And most of the time it is their home. And they need care for 24 hours, 365 days. So that's something we have to remind ourselves, like how these children they need all the time they need care. And they are the children with very restricted mobility, and they often need more than one caregiver. So a very difficult, complex profile of these children. And also, overall, if you look at not just the cancer, non-cancer, various studies have shown that how they have such high degree of pain and symptom burden. And the parents, like how it was said very nicely in the beginning, it affects the family so much with anxiety, depression, change in the living arrangement, work status, and leading to serious financial toxicity. So it's so difficult. So when you talk about pediatric palliative care, it should be available anytime and wherever they need it. So what is pediatric palliative care? And it is an emerging subspecialty. If you look at the Western world, it's very much part of their health system that they have this as a subspecialty. Whereas in India, it's just taking its roots. And it looks at the special needs of children, not just children, but also siblings, parents, and caregivers. And the World Health Organization says that it aims to improve the quality of life of children facing life-threatening illnesses and their families. But prevention, they say that you must anticipate and then provide relief of suffering. And the suffering is not just physical, but psychosocial and spiritual. So this prevention is a very important thing because we know that our children with these kind of conditions are going to suffer. So anticipate and act. So that is what we recommend. And the suffering is all dimensional. And as a team, we should be able to take care of all of these dimensions of suffering. So who are the children, suppose in IGICH, who are the children who may require palliative care? So this is a recommendation again. They say there are 4 dimensions and 4 domains. They say one category is where it is life-threatening, but curative treatment is possible, but may fail. Classic example is cancer. So if you think this children and is presenting with stage 4 neuroblastoma, think about palliative care early on. A child with severe congenital heart disease, Surgery is possible, but may not be possible to come around well and think about pediatric palliative care. So these are some examples where cure is possible but may fail. The other statistic condition is that they need long treatment to prolong life, but we still anticipate premature death. So when you see such children, think about palliative care, muscular dystrophies, epidermolytic bullosa, severe immunodeficiencies. Third condition is that from the beginning we know that it's a very rapidly progressive condition and it's palliative from the diagnosis. Like we know that. So I'm sure you must be seeing this in everyday practice, like metabolic disorders, neurodegenerative conditions, severe trisomy 13 and 18 chromosomal problems, and cancer from the beginning with no curative options. This is the third category. And the last category, I would say, if you go to the community, the biggest chunk of our pediatric